Doctor, why do I sleep so poorly? It takes me ages to fall asleep and then I wake up too early. I never feel refreshed after sleeping, no matter how long I sleep. What can I do about it? Sleep difficulties is one of the commonest complaints patients see their doctors about. It could be problems falling asleep, staying asleep, or not feeling rested after sleeping. Poor sleep is a result of certain habits that one has fallen into. And in this video, we will look at healthy habits that can help you sleep better. The collection of healthy habits that signal to your body that it's time to go to bed and your body responds by getting you to sleep is called sleep hygiene. My name is Adeze Ifezulike. I am a family physician and a lifestyle medicine physician. In my YouTube channel called Mentally, Emotionally and Physically Fit Person, MEP Fit Person channel, I talk about healthy lifestyles and how to optimize one's health. So check out some of my videos on my channel and consider subscribing, please. Now back to sleep. Let us look at the common causes of sleep problems. Number 1, mental health issues. Mental health issues such as stress, anxiety, depression, emotional struggles, relationship problems, and such like can keep you troubled and unable to relax in bed to drop off to sleep. Or they can cause you to wake up and not be able to get back to sleep. They may also mean that even when you do sleep, you wake up not feeling rested. Poor sleep worsens mental health. In one study done looking at sleep and mental health, they found that individuals who experienced shorter sleep duration had significantly higher rates of depressive symptoms and anxiety. The study also suggested a two-way relationship between poor sleep and mental health. One other study showed that adequate sleep, like 7 to 9 hours of sleep, was associated with 29% lower risk of anxiety symptoms compared to individuals who reported shorter sleep durations. One other study found that students with good sleep quality had 40% better mental and emotional regulation, and they reported higher overall life satisfaction. Further studies show that around 40% of those with insomnia and depression achieved full remission of their depression after sleep improvement treatments. So anxiety levels also improved, with some experiencing up to 30% improvement in their anxiety symptoms through better sleep alone. Number 2, the next culprit is food and drinks. A large meal before bed may cause trouble falling asleep due to the body's focus on digestion rather than preparing for rest. In particular, eating heavy, greasy meals for dinner or eating dinner too late can affect your sleep by giving you heartburn, indigestion, bloating, and an unsettled tummy. So these symptoms can wake you up frequently and make it difficult for you to go back to sleep, thereby affecting the overall quality and the quantity of sleep you get. In addition to that, after a large meal, the body generates heat to help you digest the food. So this heat elevates your core body temperature. Naturally, the body cools down to prepare you for sleep. So this increase in temperature from eating may disrupt the process and make sleep more difficult for you. Drinks are also important. Coffee can keep you in a state of wakefulness. Sugary drinks make you get up and use the bathroom more often during the night. So coffee, tea, energy drinks, soda, and some chocolate-based drinks actually contain caffeine. Caffeine is a stimulant. It increases your alertness and can make falling asleep difficult. It reduces your total sleep time and lowers the amount of deep sleep. Its effect can last up to 6 to 8 hours. So consuming caffeine in the afternoon or evening can disrupt your sleep. A study found that consuming roughly 2 to 3 cups of coffee 6 hours before bed reduces your total sleep time by a full hour. So you lose 1 hour of sleep. Alcohol, that may initially make you feel sleepy and help you fall asleep faster. However, it actually reduces your sleep quality by causing more frequent awakenings during the night, leading to fragmented sleep. It also causes people to wake up earlier than usual and have difficulty falling back asleep. Studies show that even moderate amounts of alcohol consumed can reduce deep sleep by up to 24% in a night. Sugary drinks high in sugar can cause blood sugar spikes followed by crashes, leading to nighttime awakenings or trouble falling asleep. Sugar also causes a temporary increase in energy and makes it harder for you to relax and fall asleep. Drinking too much water before bed can lead to frequent urination, which then interrupts your sleep. The other major factor that affects sleep is hormonal imbalance. Things like menopause. Many menopausal women experience hot flushes and night sweats, which interrupt their sleep. Hormonal changes during menopause can lead to mood swings, anxiety, and depression. These mental health changes can further disrupt your sleep, leading to difficulty falling asleep or waking up too early. So pregnant women also may struggle to find a comfortable position in bed. So you may end up turning one side to find comfort, turning the other side, so frequently leading to interrupted sleep and poorer quality sleep. Many also experience heartburn, which is common in pregnancy as the womb increases in size. The next big one is medication side effects. I visited a care home due to a complaint by the carers that the patient was withdrawn, sleepy, and appeared depressed. So we checked her over and ensured that there was no medical issues like an infection. She was then given antidepressants, which made her more cheerful, but it had the knock-on effect of affecting her sleep. She couldn't get to sleep anymore. So in curing her low mood, we had created a sleep problem. So medication can affect sleep. Medications like antihistamines, steroids, cold and flu medications, beta blockers used for heart issues or anxiety can all affect your sleep quality. Now, before we talk about other problems, I want to quickly make you aware as Christmas approaches that I have a lovely Christmas book for children called Rudolph, the Grumpy Reindeer and Wise Dimple. This beautifully illustrated book is not only entertaining but also educational. It offers practical ways for children to cultivate a mindset of gratitude and appreciation, which can lead to a happier and more fulfilling life. So parents and educators alike, you will appreciate the message of this book and the tools it provides for teaching children about gratitude. It's a great addition to any classroom or home library and makes an excellent gift for birthdays, for holidays, and any other occasion for children. Children love it. So head over to Amazon. I can get a copy. Just search up my name, Adeze Ifezulike, and my children's books should come up. Continuing with medical problems that affect sleep. There are other ones like thyroid issues, obstructive sleep apnea, asthma, bowel problems, passing urine frequently from prostate disease, or from poorly treated diabetes. All of this can affect your sleep. Number 6, poor sleep hygiene, such as watching stimulating movies before bed or drinking alcohol can affect sleep. Number 7, circadian rhythm disruption. Your circadian rhythm is your internal clock that tells you when to sleep and when to wake up. It can be confused by shift work or travel to places that have a different time zone from your usual. Studies have shown that 40% of shift workers report experiencing sleep disorders, including insomnia and excessive sleepiness. Many shift workers sleep 1 to 4 hours less compared to non-shift workers. Number 8, chronic pain from any cause. Example, arthritis of your joint, fibromyalgia, back pain, chronic headache and migraines, nerve type pain that you can get from poorly controlled diabetes. All of these are sources of chronic pain that can keep people awake at night. Number 9, an overactive nervous system. Example from chronic stress or use of stimulants like coffee. This can keep you from getting enough sleep. These are some of the common reasons for poor sleep, but the list is not exhaustive. Hopefully, going through this list can help you identify what may be affecting your sleep or help you remember other ones not mentioned here. So, what can you do to improve your ability to get to sleep? Your ability to stay asleep and wake up refreshed. This is where sleep hygiene comes in. These are healthy habits that train your brain and body to know when to go to sleep and stay asleep long enough to feel rested and refreshed when you wake up. So these habits take practice, just like learning to cook. Learning to cook well takes practice. So do not give up if the habits do not immediately cure your sleep. But keep applying them and your sleep will get better. Here are 20 tips and hints for better sleep. Be sure to watch till the end and I'm sure you would pick up something that will help you sleep better. Number 1, stick to a routine. Teach your body to go to sleep at the same time every day and wake up at the same time every day, even on weekends if you can. Number 2, start early. Thinking about sleep at the time of sleep is just too late. So good sleep pattern starts from once you wake up. Number 3, start the day with a walk in early sunshine if you can. This has been shown to improve your mood and help you sleep better at night. If you can't do your early morning exercise, then try and do some exercise at some other time during the day. 30 minutes, just 30 minutes of moderate exercise on 3 to 5 days of the week has been found to promote good sleep. Number 4, food. Throughout the day, be mindful what you eat. Try to eat your heavier meals early in the day when you're up and about, and keep lighter meals for evenings. Evening meals, which include vegetables and good proteins, actually help you avoid blood sugar spikes that may wake you up hungry in the middle of the night or give you heartburn. Number 5, drinks. Towards evening, avoid caffeinated drinks, sugary drinks, alcohol, and too much water, as this can affect your sleep. You can reduce your caffeine use by switching to decaffeinated coffee for a week or 2. And then if that is helping your sleep, you may want to consider taking a decaffeinated coffee 2 or 3 times a week and then gradually cut it out completely if you wish. People fall asleep easily and they actually report feeling more rested and in better mood once they are off caffeine. Number 6, avoid daytime naps. These can interfere with your night sleep. If you must nap, do not sleep for more than 30 minutes to 1 hour. Okay, keep it really short so as not to steal from your nighttime sleep. Number 7, keep your room dark. You may have to use thicker curtains to shut out light, and I find that an eye mask can be quite useful. Number 8, cool the room. A hot room affects your sleep quality. Make sure you're in comfortable clothing and can use a duvet or socks if required to keep you cozy in bed, but the room itself should be cool. A cooler room is better for getting good sleep. Number 9, avoid stimulation from phones, TV, laptops, etc. These devices emit blue light, which inhibits your sleep hormone melatonin and makes it difficult for you to sleep. Intense or emotionally stimulating content you watch can also increase your excitement and anxiety, which can interfere with falling asleep. So these devices should be avoided an hour before sleep. If you must use your phone, make sure it's set to a nighttime setting and the screen brightness is dimmed. You can check your phone for your nighttime setting. Most phones would have a setting for night. Number 10, consider turning off notifications on your phone. It can be quite disrupting to get a notification just as you are dropping off to sleep. Also consider keeping your phone on Do Not Disturb or airplane mode. That will really help you. Number 11, a bath. A nice warm bath can also signal to your brain that is bedtime, and it can increase your feeling of calm. Number 12, a quiet activity such as reading a book before bed can also create a sense of calm, but ensure your book choice will not be too stimulating as to make it difficult for you to fall asleep, okay? Or make you procrastinate sleeping because you want to finish the book. Number 13, only use your bed for sleeping and intimacy. That way, getting into bed signals to your brain and body that it is time to sleep. Number 14, avoid exercise within 2 hours of your bedtime. Exercise stimulates adrenaline, it increases your heart rate, it raises your body temperature. All this can make you more alert and make it difficult to fall asleep. Number 15, brush your teeth as a way of signaling to your body and your brain that it is bedtime. Number 16, relaxation techniques such as progressive muscle relaxation, meditation, or listening to a guided imagery exercise can help you fall asleep. So guided imagery is a relaxation technique that helps you focus on mental images or pictures in your mind to promote calmness and relaxation. It helps you reduce stress and anxiety. It improves your sleep by guiding your mind to peaceful, positive scenarios. As you immerse yourself in the imagery, your body and mind relax. There's reduction in your tension, and it promotes a sense of well-being that is good for sleep. Number 17, avoid reading anything distressful or having intense arguments before bedtime. Schedule all your difficult conversations earlier in the day if possible. 18, consider earplugs if you're a light sleeper. If you're easily woken up by sound, please get some earplugs. Traffic, snoring, or loud neighbors can disrupt your sleep. Earplugs provide a quieter and peaceful environment, making relaxation and quickly falling asleep easier. Number 19, avoid looking at the clock. Watching the time increases your stress as you worry that time is passing and you haven't slept enough. Once in bed, do not check the time. Number 20, if you haven't fallen asleep after a while, take a boring book and read for a while. I find this works so well for me, and I keep a book at my bedside for this purpose. I find that by the time I get to 3 pages, my eyes are heavy and closing. So, I hope these 20 tips and hints help you improve your sleep. Do comment down below which ones you're going to try, or add to the list. Let's learn together. If you're still struggling, please get in touch with your doctor as you may require sleep studies or blood tests to check for underlying health problems. See you at my next video.